Hello and welcome to the Wellbeing Services in the south of Glasgow. My name is Carla MacLeod. I am a specialist mental health practitioner and I will be talking you through what is OCD. As well as this audio, we do have a number of resources regarding OCD. Please have a look online. Obsessive compulsive disorder is an anxiety disorder, but it is quite a specific and severe anxiety problem, characterised by particularly upsetting recurrent thoughts that keep popping in to your head even when you don't want them to. And linked to that, the urge to carry out repetitive behaviours. So for example, one that everybody might have heard of is an unrealistic feeling of being dirty when you're not really, and getting a repetitive urge to wash your hands. And that can sound quite trivial, but at its most severe, this worry can be almost day and night for an individual with OCD, and they can wash so much that they can almost damage their skin. Well, people used to think that OCD was particularly rare. One of the reasons being is that people would often not disclose to have these symptoms because it can be often very embarrassing. Recognised as a psychological condition, there are two main functions to OCD. You have obsessions, and these are unwanted thoughts, ideas, images, that the person can't stop these coming to their mind. It creates a lot of anxiety and distress for the individual. And then we have compulsions, which is the things that the people do in order to get rid of the obsessional thoughts or to alleviate the anxiety. And sometimes these behaviours take on a ritualistic or compulsive quality. So OCD is not something that can be diagnosed with some genetic test or biological blood test. It needs to be diagnosed with an interview with a skilled clinician. And I guess everyone, to some extent, has some symptoms of OCD. But it is when the symptoms get in the way of functioning to your daily life and it causes a great deal of distress, perhaps taking up a great deal of time, then that's when a clinician would say, yeah, you meet the criteria for having this diagnosis. The first line treatment for OCD is cognitive behavioural therapy, otherwise known as OCD. And in specific, it's the techniques of exposure and response prevention, which is a certain form or certain technique of CBT. It is a treatment in often a relatively short amount of time, and this can be really effective for people. So let's just recap. OCD is an anxiety disorder, and the way in which symptoms we experience varies widely from person to person. So, the two different elements that we've just previously discussed are our obsessions and our compulsions. Our obsessions, an unwelcome thought or image that you keep thinking about, is largely out of your control. These can be difficult to ignore. These thoughts or images can be disturbing, which can make you feel distressed and anxious. A compulsion, something that you think about or do repeatedly to relieve the anxiety. This can be hidden or obvious, such as saying a phrase in your head to calm yourself or checking that the front door is locked. Many times. A common symptom of OCD is having the obsession and the fear of contamination. What do we do to resolve this? In OCD, you would wash and disinfect very frequently. You would avoid going to places, touching objects that you fear may contaminate you. Or perhaps the obsession is about symmetry. And this is like things in your life that are not in the correct order, are not symmetrical enough, will cause you anxiety. Ornaments that are not aligned. You may feel distressed due to this. So what you do, your compulsion, is you put things in the right order. You make them symmetrical until it feels right. And often, excessive time is spent on these tasks. It really can be detrimental to your overall quality of life. Accepting the thoughts, feelings and uncertainty can often be the first step to breaking free from OCD. Our thoughts are not true. Challenge these thoughts and try changing them. I like to think of this as the 3 C's. Catch it, check it, change it. So in terms of thoughts, catch it, identify the thought that came before the emotion. Check it, reflect on how accurate and useful the thought is, and change it. Change the thought to a more accurate and helpful one. As OCD is an anxiety disorder, it can take over your body's alarm system. So this is a system that is there to protect us, and one that triggers what we call the fight or flight response. But instead of only warning you of real danger, that alarm system begins to respond to any trigger, no matter how small. It can be absolutely terrifying. Feels like a real and true catastrophic threat. How can we relieve this? Look at our information sheet on tips to manage this. One of the main things to do is learn how to relax and learn how to breathe. So when we have an obsession, an intrusive, distressing thought, image or urge, this increases our already high anxiety, which then makes it more difficult to avoid doing any of the compulsions. Repetitive ritualistic behaviours to lower this anxiety. This is the only way that we know how to cope at this current time. But what if we could actually learn to decrease our anxiety and challenge those compulsions and challenge those obsessions? Please have a look at our online resources. There is some fantastic stuff that can help you. We also have a group that is available, and this will take you through session by session cognitive behavioural therapy for OCD. Thank you.